little word cloud starting to develop. I'm seeing a lot of Multnomah County. I'm seeing Marion County. If you're referring to the chat, we have Benton County, another Multnomah, maybe Jackson and Josephine. So really great representation across the state. Umatilla, Lane County. Um, this is great. Columbia County, Clark, Benton. Awesome. Feel free to keep submitting those, but for sake of time, and there's lots of folks in this room, I want to ask you another question. I'd love to know what organization you're representing today. So who are you here representing? It could be community member as well if you are here because this topic interests you or a big fan of OHA. But tell us more about who you are. If you're watching the Slido, we have Columbia County Public Health. We've got family building blocks. We've got OHA, which is great. Malheur County Health Department. Volunteers in Medicine in the chat. Oregon School-Based Health Alliance. ARC in Lane County. It's so fun to get to see the variety of folks who show up in this space together to learn together. And I'm excited to be sharing this space with you today as well. All right, again, for sake of time, I'm going to move on to our third and final get to know you question. Before we announce ourselves, have you heard of us? Who has heard of the Moore Institute previously? You can say not yet, you can say yes, I'm a big fan, follow all of your e-news and Moore Institute emails that come through my inbox. Can't wait to learn. Thank you, Dolly. I appreciate that positivity. In the Slido, we're getting a lot of not yets, which is great. That is why we're here today. So with that, I'm going to go ahead and stop our Slido, and I will hand it back to Leanna.
So we kind of expected that we were going to get a lot of like, I don't know if I've heard of you. OHSU, yeah, got OHSU, but the Moore Institute, we're a very small institute within a very, very large organization. Some of you are familiar with that, like OHA is sometimes the similar kind of situation. We were founded in 2011 by a gift from Bob and Charlie Moore of Bob's Red Mill, hence the Moore Institute. And it was really to take a field of science that OHSU was already a leader in internationally, called the DOHAD, or Developmental Origins of Health and Disease, and find ways to translate that science into improved population health. And so we've been doing that in several ways. And I'm going to tell you a little bit today about the science itself, if you don't know too much about that, and why we ground all of our work in this field of science. So first, this is not a shocker to any of you, my lovely public health nerds all across the state. I love being here with people who are like right, in my alley. The roots of chronic disease are deep. The systems that contribute to their growth are complex. No simple solution or single organization will ever be able to resolve this epidemic, right? It takes lots of us all working together and working at different levels. And there's no just like, so we're never going to like just silver bullet, let's just fix it. Well, it'll make it go away. But we really look at this from a certain perspective. We like to think that, babies are the record keepers of society's decisions. You can get some little Whitney Houston music going in your head if you want the future. Anyway, we want to see like, what would the world look like if we really focused on future generations, if we didn't just think about the here and now and how our decisions were impacting us right now, how we could treat disease right now, but if we were making decisions about our world, about our policies, about our systems, thinking about the next generation. Now, this works not just with health, but with overall planet as well. So that's how we kind of ground a lot of our thinking. Now, before I dive into the science a little bit, I do like to preface this by saying that I will be using some gendered language. I will be talking about some historic trauma that has caused inequities across our world. So if any of that causes anything for you, you can just step away for a few minutes. But really, the key tenet of DOHAD is that the environment during the first 1,000 days, and the first 1,000 days is from conception to about age 2, is the largest predictor of chronic disease risk. And so we're talking about exposures to things like poor nutrition, to toxic stress, to certain chemicals within the air, the water, that people are exposed to during this time period really sets your lifelong risk of developing most chronic diseases we can find an association with, but some even more than others. And we know this from this guy named David Barker. He was an English epidemiologist who was working in the UK in the 80s and found um, maps that babies born at low birth weights, he could find similar maps matching adults dying from heart disease. So he was trying to dig into this a little bit. Back in the day, we used to have, nurses would go from home to home with every baby who was born and really measure everything, height, weight, how the mom was doing, how the baby was growing, what the family was like, siblings. And he was able to find these records in one specific county and then match them with later life death records of people. And he was able to find an association between babies who were born small, at the small end of the birth range. And we're talking about full term singleton babies who were born in the 5 to 6 pound range, had a much higher risk of dying of heart disease as an adult. So he really wanted to understand what this connection might be. He had a lot of pushback when he initially started talking about this. But one of the people he talked to was Kent Thornburg, who works here at OHSU, who is a developmental physiologist. And he said, I know that this is kind of your area, how the heart develops. So I want to work with you and figure out how birth weight could impact dying of heart disease. Kent said there is no way, there's just no biological mechanism that makes this possible. But I will work with you to prove that you are wrong and make you stop walking around talking about this and trying to present papers so that we can all move on. So the two of them did start working together. David spent the last 10 years of his career at OHSU. And lo and behold, Kent, after a few years, said, well, I guess you're right. And so they were some of the first people who really dedicated their careers to understanding the biology between how you grow before birth and how that impacts impacts chronic disease risk. All right. And we now know, even after David had died in 2013, that babies born at the high end of the birth weight range, so these are babies born over 10 pounds, also have an increased risk of dying of cardiac disease. And we've found associations between type 2 diabetes, obesity, high blood pressure, asthma, COPD, certain forms of cancer, and several other chronic diseases. And we know that it's not just birth weight. So you're like, okay, well, what is happening that the weight is causing this risk? Birth weight is a proxy that we can sort of use to measure how someone grew before they were born. But there are other aspects that are affecting this. Maternal body type has an impact. Fetal-placental sex has an impact. Male fetuses grow faster, quicker than female fetuses on average. There are paternal effects, and we are learning more and more about those. But it is generally we're thinking probably a 70 to 80% of it is coming from the egg side versus the sperm side. And then the placental size and shape specifically has a very strong association with how a fetus grows before birth as well. And not to like dampen your day with too much biology first thing in the morning, I guess we're not first thing in the morning, but right before lunch. If you haven't thought about this too much in a while, a person doesn't really know that they're pregnant right away, right? So every month, if you have functioning ovaries, you're releasing eggs. And if there happens to be sperm in that oviduct and the sperm happens to fertilize the egg, then that fertilized egg spends almost a week traveling through the oviduct before it may or may not implant and cause a pregnancy. But during that time period, that early embryo is already sending out signals and getting information on basically the building blocks that it has to work with. So it's setting a path for growth based on what it's already got available. And so if a person at that point is been eating poorly or has not had access to be able to build up proper stores of muscle and nutrition over their adolescence, it's setting a slower path for growth. which will result in a lower birth weight baby. And there are two ways by which this happens. I won't go super into the science. If you want more information, absolutely email me. I can send you all kinds of papers. But there are two ways that this happens. There's structural and epigenetic. So a fetus that's just set on a slow path for growth is just focusing on the pieces of the body that it has to have full control over while it is in the womb, rather than the organs that will later fully develop after they're born. So you can be born with fewer nephrons in your kidneys, for instance, which are the filtering cells, which is, making your kidneys over time more likely to be at risk for high blood pressure and diabetes. But then there are also epigenetic changes that are happening, which is different genes that are not changed, but that are either turned up or turned down. So you can have health promoting genes that are turned way down and health harming genes that are turned way up. And these can actually be passed from one generation to the next. And importantly, we also know that the stressors that are impacting the growth of the fetus, so poor nutrition, high cortisol, low oxygen, toxic stress exposure, are also impacting the future health of the mother or that pregnant person later on in life. So I want to talk a bit about how this impacts how the health of one generation impacts the health of the next two generations. I always like to try to do this with, a little bit more personal, because that's what makes it make sense to me. This is my grandma. She lives in Indiana. She's 93 years old. She's still kicking it. Love her dearly. Spend time with her every time I can. But a female fetus is born with all the eggs that she will ever have. So the egg that made me was formed when my grandma was pregnant with my mom. So in my mom's uterus, when she was a fetus during my grandma's pregnancy in 1953. So in egg years, I am a senior citizen. Not in real years, only in egg years. So we can look at the health of our generations, or health of our current generations, by looking backward. The things that my grandma was exposed to, the nutrition that she had access to, the toxic stress, the chemicals that she was exposed to, impacted the egg that became me and has an impact on my current health. But we can also look at this going forward. So this is me pregnant with my daughter, who is now a teenager. So when I was pregnant here in 2009 with my daughter, the uterus that was developing in her as a fetus also was all the eggs that she will ever have were being developed at that point. So what I was eating and what I was exposed to was nourishing the egg that will hopefully, fingers crossed, someday become my grandchild. So in that way, the health of one generation is actually, you're impacting 2 to 3 generations at a time. So it's all well and good to say like, oh, well, we should just make women eat better. Done, fixed. But we know that while the mother provides, or the pregnant person provides the environment for the developing baby, society really is providing that environment for the mother. And you can't take the pregnant person out of the environment that we're all a part of. And so those nutritional stresses, the food that we have access to, the food that is marketed to us, social stressors, toxic chemicals that is in the air, the water, microorganisms, all these things are impacting the pregnant person as well as the developing fetus and the next generation as well. So we call these first hits. So the poor nutrition, the toxic stress, that is sort of a first hit that is impacting you. And we know that risk is not reality. So just because you are born with, maybe your parents didn't have access to lots of fresh fruits and vegetables, it doesn't mean that you're doomed for life, right? That's just one issue that you have at birth. But the problem is that most people who are born with first hits are born into an environment, food deserts, air pollution, abuse, that the second hits elevate the first hits risk. And in the same way, the first hits of one generation, the second hits of one generation can end up becoming the first hits of the second generation. So somebody is has been born with the first hit. They're living in an environment where they still don't have access to food, to healthy foods, and they're still living in poverty or other toxic stress and issues. Those second hits happening while they're pregnant become the first hits of the next generation. I hope that made sense. I kind of confused myself for a minute. And we're going to turn it over to Nikki. Now she's going to do another quick question for you. And then I'm going to talk a little bit about our current work.
Yep. So for those who are fans of Slido, you can log back into that Slido. For those who want to answer the next question in the chat, by all means, go ahead and answer the chat. Here's that QR code though, or the website if you'd like to do the Slido. And our next question is, how does DOHAD, this research, show up in the work you do? So you've just learned quite a bit about the background foundational research that the Moore Institute sits upon that guides a lot of our work. Leanna, can I get the next slide?
Yep.
But tell us, how does this show up for you? In the areas, the organizations you work in, the projects you're involved in, can you see connections on how this work shows up? I'm happy to read out a couple of the highlights. So we've got social determinants of health. Those who are working the social determinants of health may be seeing some really clear lines. Educating parents, systems alignment, the partners that we serve, the parents that we serve. I'm seeing health of older adults with disabilities, working with adolescents in health and current projects, WIC team members. You can see a lot of the connecting points far beyond the research application where DOHAD really shows up, and we hope to show you some connections on how we have put that DOHAD in action in the communities we work with. So you can keep answering that question as we move on. We'll keep taking those answers, and Leanne, I'll hand it back to you.
Then I've told you a little bit about the science. You're like, okay, great, cool. That's scientists. You have your science. What are you doing with it? How are you actually using this? And that's the part that, you know, for OHSU, we're a little bit of an unusual institution because we don't do any direct patient care. The basic research is done within an organization that is associated with us, but it's not the Moore Institute per se. So what we're really doing is translating that science and working directly with communities to find ways that it can be implemented to improve community health in on a local basis. So some of the things we've done when we first started, you look at the low-hanging fruit, you're like, oh, curriculum, right? We're an educational institution. We have several curriculum, both continuing education, and we have a nutrition in a box curriculum for middle school students. We do a lot of community events. We like to provide speaking opportunities for the researchers here. We're trying to teach some of our basic science researchers how to interact with real life community people so that they can get out of the bench and out to the community, because we really believe that if you're doing this research, you need to have an understanding of who you're doing it for and what you're trying to impact with this down the road. We're working on a documentary right now that we're close to being done filming this spring. We'll be submitting it to some film festivals and finding distribution, but it is really focused a lot on the science and the implementation, and not just here at OHSU, but with some researchers from around the globe. We have the Hunger, Nutrition, and Health and Pregnancy Action Collaborative that I'm going to talk to you a little bit more about. And then Nikki is really going to dive into our largest organization, the Nutrition Oregon campaign. So the first one I'm just going to talk a little about, we do these things called community nutrition consortiums. We've done them since we started, but they're basically identifying a local advocate within a community. Normally those communities are geographically focused, but we have done some that have been more like racial, ethnic sort of focus. And we work with that person or persons to really identify how DOHAD shows up in their community, how they really see how this work could impact issues currently happening in their community. We do a sort of like half to 1 day meeting seminar type thing. We invite people who work in fields related to this work. We'll bring experts from the Moore Institute to do some like, here's the science, or something that's really more specific to how this community sees the work. We've done things specifically like breastfeeding. We've done actually just toxic stress exposure with a specific interest on substance abuse. Can't think of, but we really try to target the science to what this community is looking for. And then we'll have local presentations from groups in the community talking about the work they're doing, because the goal really is to create connections between community members who are already doing this work but maybe don't know each other. And then between the communities and OHSU to see how we can help support the work they're doing or help grow, or how we can then connect them with other communities that we are working with across the state who we know are doing similar kind of work, and to be able to share some best practices. So we're trying to do about 2 of these per year. So if anybody's interested in hosting one, let us know. And the other thing I want to talk about before I hand it over to Nikki is the national strategy. So as part of the Biden White House created the National Strategy on Hunger, Nutrition, and Health a couple years ago. They had a major conference. Following that, there was a challenge where they asked people to submit what they could do to be part of this action collaborative that's being organized by the CDC Foundation. The Moore Institute was asked to submit a challenge, and we were accepted. And that is based for us around our Nutrition Oregon campaign, and really expanding that to touch every county in Oregon by 2030. So we're active still in this national group that's really trying to continue to forward this national strategy, even going forward when we will have a new president in the White House. And this is just a little bit sort of showing how we have spread out this commitment over the next 5 years, and where we are doing some of the work, where we've already touched and where we have yet to touch. And then I am going to pass it over to Nikki to let her dive in more to the specifics of the Nutrition Oregon campaign and how that works. Take it away, Nikki.
Awesome. Thank you so much. So Leanna set up a wonderful foundation on what the Moore Institute does. So I get to talk about how do we put that research, that information into action. And it really started with this idea of how can we get out into the communities? And as Leanna mentioned, our biggest program here at the Moore Institute is the Nutrition Oregon campaign. And the idea was, how do we reach every county in Oregon with the science of DOHAD? So as she mentioned, again, the foundation of highlighting that we are interested in those first 1,000 days, and we know that the mother is the environment in which that child is being reared, but it's the community that has an impact on that mother. So reiterating that if we don't address the community, then we therefore can't address the mother, and therefore cannot address the child's health and wellness. And so that is why our focus is broader than the individual. It's to work within the community, social and environmental, and even the policy needs. And we also acknowledge that it can't be all put on the person. So knowing, I'm sure many people in this room are very familiar with the health impact pyramid, but we know that if we only address that very top piece, we are missing an entire set of other structures that impact the direct environment and lived experience of every human. So the need to urge behavioral change is symptomatic of a failure to establish context in which healthy choices are default actions. So we wanted to work with communities to find ways to highlight how we address not only the counseling and education top of pyramid, but start working down into clinical intervention, long-lasting proactive, changing the context and socioeconomic factors. But where do we start? So the Moore Institute did a lot of legwork to really decide, what does this look like? If we are going to create a campaign that's statewide, how do we get the information? Where do we start? So it was a unique approach to a complex problem. So there were statewide listening sessions, mapping existing work happening in communities, identifying the gaps, and develop and testing messages. And in that work, almost 2,000 miles were traveled, 6 different communities were visited, over 150 leaders, sector leaders were reached, and it was all funded by the Ford Family Foundation. So really taking time and energy to hear communities, engage with them, and listen to what they saw as opportunities and barriers to the challenge we were experiencing. So as you can see, there was a number of listening sessions and tours to held where we are here in Portland. We went out to Ontario. We visited Klamath Falls. We went to Medford Bend, which was a conjunctional visit with a nutrition consortium. So kind of tailoring an event to that community, and also out to the coast to Newport. So really trying to reach the various corners of the state. And by visiting and listening to those communities and with the help of a core collaborator group that was created to help navigate this work, we identified 4 areas that we were really trying to change. One being healthcare policy and the delivery of prioritizing prevention work. Acknowledging nutritious food is available, making sure rather that nutritious food is available for all women, children, and families. Schools and out-of-school programs provide children and adolescents nutrition, not just food. And making sure that DOHAD science drives policy and research. So as we acknowledge that these were our key shifts, we also wanted to highlight the key sectors that we found champions and identified that were critical levers that could help change and facilitate change rather across a multi-levered system. So we identified a K through 12 education, healthcare and health system providers, community health workers, and government business community leaders. And we know each of these sectors is already doing the work that could be considered DOHAD related. And many of you identified yourselves as part of these sectors doing DOHAD related work. And so the effort was then to link and expand the efforts with a common goal. So with that key group of guiders, we set a vision to fully utilize the power of nutrition to end chronic disease in Oregon for all, with a specific focus on closing the gap for those most at risk. And with that vision in mind, we are guided by principles. So you can read them here, and I'll highlight a couple of things from these principles. First and foremost, everyone's deserving a start to life on an equal footing. We are guided by that chronic disease rates will not decrease until we improve the nutrition levels of infants, adolescents, and women or people of childbearing age. Communities cannot access healthy food if the built political and social environment don't support healthy choices. Community members best understand the unique structural barriers to nutrition that they face. They should be the driving force in developing the vision and interventions to improve nutrition in their own populations. And finally, if Oregon leaders are knowledgeable about the effects of nutrition on chronic disease risk in this and future generations, they will be motivated to work with communities that they serve to generate and support solutions. So this is our foundation as we move forward into this work. We also had to figure out how we sit there. How is the Moore Institute most instrumental in supporting communities? And we really identify ourselves as the backbone. And for those who are less familiar with the kind of idea of a backbone, core functions of backbones are really to provide guidance and vision, ensure effective coordination and facilitation. We act as conveners to bring together our stakeholder partners. We develop those partnerships or strengthen those partnerships, and we might lead efforts to develop funding. Some of the other ways you can see here on the screen, we support the collaborative capacity and development. We work on translation and application of the science specifically, so it's digestible and accessible to the communities we work with. We develop tools and communication materials, and we link statewide shared learning networks in addition to that funding element as well. So we knew we wanted to create this statewide campaign. And as we started developing the system that it would look, the structure that it would look like, we acknowledged that the communities that we would support would be our hubs. And so what those hubs' objectives would be they understand what's happening. Their community, they're the stakeholder input. They understand and implement a systems approach. So they're thinking about shifts in the individual level outcomes to coordinate multi-level actions. There are links in our leverages, right? There, the community initiated are links to coordinate and leverage for increased efficiency and impacts. They're there to engage and educate. So they're gonna engage and broker connections among leaders within their community and in key sectors. and community members to broadly share the translated science. So they're going to be able to take the science that we have and bring it back down to their communities in ways that fit their communities. And they're there for community action. They've got project-based grounded work in DOHAD, meeting community need and system level change. So this is what we were creating. And with that creation, this is what we're doing now. So our current work. The Nutrition Oregon campaign is a statewide network of connected communities and like-minded organizations, challenging the system factors that contribute to chronic disease. And we currently work in 4 different communities actively. And so I really wanted to take some time with you today to highlight the work that they're doing. So first we have Klamath County. Our partner organization with Klamath County is Healthy Klamath, and they have set a really audacious goal, and we ask all of our communities to set audacious goals. But theirs is to reduce reduce rates of low birth weight babies under 5%, which is below the statewide average by 2029. So they're a group of community stakeholders meeting regularly to address this issue through a variety of projects and initiatives. And one of their really successful projects they've been working on that I wanted to highlight for you today was their Healthy Baby Curriculum, an online curriculum meant to be dispersed to lay health workers. It includes videotape modules and written materials that lay health workers can take into the communities that they work with and translate to those communities in the ways that fit best. That current curriculum is live online, is accessible by anyone who's interested, and I'm happy to send that out. But what we're doing now is using that curriculum to translate it into other languages, and also using that curriculum to now look at the non-pregnant parent or the supportive community around that pregnant person in ways that they can take care of not only themselves, but of that pregnant person. Because we acknowledged earlier, it's the community that creates the environment for that pregnant person. So that's a little bit about Klamath County. Our next and our oldest hub is our Eastern Oregon hub, which we also call the Western Treasure Valley Food System Partnership. And they started with a audacious goal, again, of reducing rates of food insecurity and diet-related disease among children and adults in Eastern Oregon by 2030. They formed to help implement the Regional Health Improvement Plan and support community initiatives throughout the 12 counties served by the CCO, EEO-CCO. And they launched an expansion of the Frontier Veggie RX program in Malheur and Harney counties. They've also hosted webinars, bringing together partners at the intersection of housing and nutrition. And they also have worked into a phase where now they have a partnership and another backbone organization, the Oregon Food Bank, that brings together a group of partners, as you can see there in the left-hand corner, that have really skyrocketed in their impact in that space. And we are excited to be sitting at that table and helping facilitate that work. But the Western Treasure Valley Food System Partnership is a wonderful example of the evolution of some of the hubs and how they can really launch themselves into a whole other phase of work beyond the Nutrition Oregon campaign. Our next hub is Yamhill County. Our partner organization there is the Yamhill County Public Health Department. Their goal, as you can see there, is to co-create a culture that values nutrition to ensure that 100% of Yamhill County residents can acquire and enjoy food that meets their cultural needs. Their leadership team spent more than a year conducting interviews with stakeholders and community members, scoping out their work and drafting their goal. Over a series of virtual events, and their team was able to convene over 30 community partners to confirm that their hub's goal and the design was meaningful and relevant to reach that audacious goal. More recently, the Yamhill County has seen great success in the development and launch of their VegRx program, which you can see there, the logo in the left-hand corner, where they're in the process of recruiting 50 expecting families that are part of in-home health nurse visits in partnership with Meals on Wheels. And so they are leveraging the 1115 waiver, have received funding through that initiative, and are seeing the success of this program and thinking about the next phase. What happens when these families quote unquote graduate or move past their VegRx, and how this hub can help serve as a bridge into the next phase for those families. And definitely last but not least, our newest hub, the Douglas County Hub, our partner organization being Thrive Umpqua. They launched just this last spring, so in May of 2024, and they have hit the ground running, focusing on training and educating practitioners on the importance of DOHAD and also connecting with local artisans on beautification projects within their communities to illuminate the importance of breastfeeding. And as you can see, their goal is to improve the lifelong health and well-being of this generation and the next by ensuring all babies in Douglas County are born at a healthy weight by 2033. So those are just some of the really wonderful things happening within the Nutrition Oregon campaign, and a little snapshot of what their current work looks like. So what's next? Leanna gave you a nice overview of some of the work that we do outside of Nutrition Oregon campaign, but to reiterate and highlight some other areas, we're continuing to support our current hubs through their phases of development. We are still the backbone, convening and supporting those hubs. We're looking to develop new hubs through that national strategy. We're scoping and excited to enter new communities and find ways we can support them in ways that fit what they need. We're always developing and thinking about ways we can support culturally specific audiences through our engagement opportunities. We're always interested in working with traditional health workers, those who are on the ground in the community doing the work, in ways that we can connect the science down to the community members themselves. And we'd love to find ways to continue to support work through ACEs and how the DOHAD can directly support those communities that put ACEs at the forefront of their work. But we wouldn't be able to do any of this work without continuing to reflect back on our lessons learned. And so some of those lessons I've highlighted here. We meet communities where they are. We are committed to building strong coalitions with a variety of voices. We really try to balance the science and community needs and funding opportunities. The projects must be community-led and owned by the community in order to be successful. We are very, very committed to starting small and letting it grow. It's easier to sustain even if there's a small dedicated group of people. We see really powerful things happen that way. The science is the spark, but it must be reinvigorated all over and over. Organizational shifts and personnel turnovers can disrupt workflow, but we navigate through that and support the community members that continue to be there. We acknowledge everything takes longer than you think it will, and we are okay with that. We're here for the long haul with all of the communities we're with. And if it was easy, someone would have done it already. So my last Slido for you. You want to go to the next slide, Leanna? What's one thing you learned today in today's presentation? We'd love to know what struck you, what's something you're going to take back to your communities, to your workplaces, what's something that's going to pop back into your minds later. Let us know what you learned today. Oh, eggs are magical and powerful. Agreed. I repeat the multi-generation egg thing to people all the time, and the big eyes I get when folks realize that that's what's happening. Yeah, Carrie in the chat, there's so many opportunities. Yeah, there's lots of opportunities. A lot of acknowledgement of the multi-generation effect, how important it is to live a healthy life so I can support the next 2 generations, the generational impact of nutrition. It's a really powerful topic. Please keep sending those topics. Please stick them in the chat, and we'll continue to move on. I want to leave enough time for some questions at the end. But Lena, can you move to the next slide? So how can we work with you? So we're here not only to spread the word of DOHAD and emphasize its importance, but also talk about ways we can continue to connect with you who've taken the time to share this space with us. And so as Leanna mentioned, as I've alluded to, but I'll reiterate here, the Moore Institute does tailored DOHAD presentations or science talks in communities. We work with communities all the time to come into your predetermined event or set up independent events to talk about DOHAD in the ways that fits your community. As I mentioned here, participate in your related events, tabling or speaking engagements. If nutrition consortiums sound interesting to you and you want to entertain that idea, let's talk about it. Or if you're feeling extra motivated and really the Nutrition Oregon campaign sounds like something you'd like to learn more about, please let us know. Or if there's something else, if there's another thing that is sparking your brain that we have not thought of or that we haven't mentioned today, let us know. We would love to think of out of the box ways we can support you, support your community, and connect this science to the folks doing the work on the ground. And with that, this is our contact information. You're welcome to reach out directly to us. If you're in the Slido, I've also put up another slide. You're welcome to put your email in that. We'll collect that from you and reach out specifically to you about how we can engage. But thank you so much for allowing us to be here today. And I think we have a little bit of time for some questions.
Yes, we do. Thank you, Nikki and Liana, for being here and for sharing about the work that is happening at the Moore Institute. There are a couple of questions that have popped up in the chat that I see. I do want to scroll back up because there was a question that Janet asked about earlier of if there are opportunities for community workshops in Spanish. And I want to kind of broaden that question to like, what resources do you offer to come and share about this information for communities that speak many languages in Oregon?
You want to take this, Nikki, or you want me to?
You can start and I can add in.
I was going to say, we did work with Familias en Acción and to work on developing their AMY curriculum, the Abuela, Mama y Yo, that is in Spanish, hence the, Familias Abuela pieces. We are working to translate some of our existing materials into other languages. My pregnancy plate is in English, Spanish, and Russian. We translated David Barker's initial book into Russian, which we have a whole bunch of copies of that in Russian. If anybody needs some, please, I will send you a whole box of them because they're taking up space in here. And otherwise, I'll let Nikki add on to that.
Yeah, what I'd like to add is many of the Nutrition Oregon campaign hubs who've developed curriculum, Klamath Falls being one of them, is in the process of translating for their communities, and those are open source resources. So as those come available, they'll be promoted through our virtual newsletters on our website, et cetera. But if you have a specific ask around a particular topic, around something, and need it translated to a language, ask us, and we would love to think creatively with you on how we can make that happen.
So, the next piece, there's a share back and a question from Jamie around the DOHAD research having opportunity, more work to do to talk around body size, mentioning obesity. And then the question is, how is the Moore Institute integrating a fat justice approach into their work, not necessarily just relying on weight as a health indicator? And also, as we know, the way that BMI was created was very ableist and racist and all the things. So Jamie has a comment and a question. And Jamie, I see you came on camera. So if I misrepresented what the intent of that question was, please let me know.
I'll start with this one too, Nikki, and you can jump on. I agree with you, Jamie, and it has been it's been a learning curve for everyone here because we do work with biomedical folks and researchers think of obesity as a disease, right? And so we've been trying to change our language, and you're right, I did not in this presentation, but start talking about people who live in larger bodies and looking at it from that perspective. One of the folks we work with in the Nutrition Oregon Campaign Hub in Ontario is a dietitian, and this is a passionate area for her. And actually someone in Yamhill as well. And they're constantly working with us to sort of like tweak the language we use and how we talk about this, because that is something that we have to acknowledge, especially going forward.
And for those that may not be watching who's on camera, Jamie gave some hand hearts back for that answer. And yes, I really love that the conversation doesn't end. That we take what we know, and when we know more and when we know better, we can do better. But thank you, Jamie, for asking that question. Very important. Janet has a logistics question. Is there a way to set up one-on-one meetings to explore partnerships and ideas? I'm seeing some head nods, Nikki.
Yeah, you are welcome to email Leanna or myself about setting up. We love chatting about ways we can support or coordinate. So our email is a great way to get a hold of us.
Perfect. Hannah has a question. Are you able to share any of the studies / research that you all referenced with this particular group? Yes. Okay. That was a quick yes from Leanna.
I can send over a couple of some more lay-friendly basic studies that cover the broad topic. Or if you really want to get into like specific like histone modification, I can find those for you too.
Yes. Oh, I should have been more specific. There are two comments from Hannah's, but they are separate Hannah's. So that was from Hannah Smith. The next one is from Hannah Corey. Shares, I see a lot of opportunities to reflect on the ways we can push this work to be less paternalistic and include more analysis of oppression and power dynamics that are driving these inequities. I would love to think about solutions that don't place the burden on birthing parents to overcome structural oppression. So I just want to make sure that was shared verbally out into the space as well. And, Nikki or Leanna, if you have reflections on that as well, would love to hear them.
Yeah, I'll just say, yeah, we agree 100%. That is how we work with our Nutrition Oregon campaign. The intention is to take the burden off the birthing parent and move it into policymaker, leaders, decision makers to change environments to support communities, overall health, and therefore supporting pregnant folks in their experience in nurturing their fetuses and future children. And so, yes, we support that, and the variety of voices we have at the tables at our Nutrition Oregon campaign hubs would definitely agree with that. That is the intention of all of this work.
The last thing I'm seeing in the chat is a shout out for Jamie's question around holding ourselves accountable for the language that is used around weight when we're talking about health, when we're talking about nutrition, when we're talking about wellness. So I just wanted to also share that that's echoed. Folks, we still have a couple minutes. If there are any questions from the group, if anybody wants to share in the chat or come off mute, I'm also opening up the floor. I know Dolly's double checking a couple things at the moment, but if there are any reflections, anything that you're taking away from this, Dolly, that you want to share with the group, yeah, any closing thoughts, I guess.
I just want to thank our guests. We have both CBOs and local public health partners in this space. And what I heard is a lot of opportunities and an ask for communities that are interested in this topic to engage. And I'm pretty sure I saw you drop your email addresses. So maybe I'm just going to be like, boop, boop, drop your email again. It seems like meetings can be requested. If you have questions, it sounds like materials are available in other languages. Y'all, as my daddy would say, closed mouths don't get fed. So go ahead and reach out, ask your questions. We don't always have all of the resources. In fact, we don't. But we know people and we like to make friends. So thank you again for being here and sharing this information with us. And I hope you all take advantage of it.
Amazing. And as always, folks, gentle reminder, you will get a follow-up email with the recording from today's session, the slides that were presented, including email addresses to contact our presenters. And I also put all the links to all the things that were shared today by our presenters in the chat. those will also make it into that follow-up email. So please be patient with that. We've got to send the recording to our IT people, and there's some converting fun IT things that have to happen, but it will come. You will get those resources and that information. And then please come back the first Thursday in February for our next chat, where we will have another session to talk about legislative session. So you asked for that information to roll back around. It is coming. And I hope that you can join us on that first Thursday in February. Other than those last things, and I'm seeing a lot of sharing of emails in the chat. We're going to do it all. We're going to make the connections. Please enjoy your Thursday. And you know how to get a hold of us, Dolly and I, if anything comes up between now and next month. So thank you for joining. Thank you, presenters. Thank you, attendees, for coming and learning and engaging in great conversation. We will see you later.
Thank you all so much. Appreciate you.